I said, I mean, the biggest thing that I've seen so far within the practice is there's an abundance of information, and you have to know what you're doing and where you're going with everything and what you want to specialize in. And you have to be able to. I, the biggest thing that I found is that there's a point where you have to separate your mannerisms, your personal your personal interests, and the way that you are as a person, and then in a clinical aspect, because I noticed that the line is very thin sometimes about how interested you are or exactly what you say or portray. It seems like at this point I can't understand why 10 years is involved in becoming to counsel. Why do you think it is, or what did you find about how an entire decade is to be devoted to the practice?
Well, you can do it with 6 years with a master's degree. You know, you don't have to have a PhD. A lot of counselors don't, and they're very good at what they do. It's just more depth of learning, more depth of skill training, that sort of thing. Knowledge is power, so the more you understand yourself and others, the more power you have to help them change. When you're messing with people's lives, there's a lot at stake.
Yeah, absolutely. Do you have any integrations with? I mean, I guess I also wanted to touch on the point that since you do work with everyone, and then you might work with extreme cases, how close does your practice get with medicine as far as neurology and, I mean, actual brain components and disorders and things like that? How does counseling integrate with neurology, and do they?
A lot of my PhD level stuff was about that, with the effects on brain and stuff with addictions and alcoholism and all that sort of stuff. A lot of classes on neurochemical stuff, the effects that it has, and the different chemistry of depression and stuff like that. That was all part of schooling and training. Part of why it takes so long. There's a lot to know.
Absolutely. Is that something that you practice here? I mean, in counseling, is that something that, say, someone comes in with a neurological disorder, is that a big part of the treatment?
No, my part is more along the lines of counseling with the issues and living and stuff like that. The medical part of it, I don't mess with that. I refer that on to somebody with more expertise in that. Psychiatrists and different ones, medical doctors.
What do you want, I mean, what is the best thing that a client can come out with at the end of each session?
A willingness to change.
A willingness to change
Yeah.
themselves.
Sometimes they leave here sadder or more broken up than when they got here.
Yeah.
Because from crisis is where change happens. Sometimes my job is to help them put their life in a crisis to where they have to change. It's
Yeah.
not my job to make them happy.
Yeah, I do see that being utile. How do you do that?
Case by case,
Yeah.
person by person.
Yeah. I guess my experience is that I think that one of the biggest issues that I've seen with clients is that a lot of clients can't do that by themselves. They can't change. They don't see
they're
the,
stuck.
They
That's
don't
where
see
clients.
the use in changing,
Mm-hmm.
and they don't want to help themselves, or they can't help themselves. They've told themselves.
Mm-hmm.
So, what happens when you? I mean, is that a common occurrence where you see people that don't want to help themselves?
No, in private practice especially, that's not an issue because usually those people don't come to see you. You know, you saw that in the psych hospital where people are committed and put there against their will. They don't want to change and don't want to get better. But you don't see that so much in private practice.
Wow.
because if they don't want to change, they usually don't go to counseling in the first place.
Yeah, yeah, I do see that. I guess lastly, I just wanted to ask about, because I've read, this was in a book about clinical psychology, and what they were stressing is that you do see a lot of numbers and things, and so is there anything that you do with data? Do you use not specifically patient data or client data, but is there anything that you can do with the treatments that you provide to find out what would be effective for others, or what could be effective?
Yeah, that's why they do studies all the time, is to come up with statistics of what's effective and what's not effective, what works best with certain populations and different things like that.
Do you use any of your data? Do you put together any graphs?
No, I don't really do any of that much. I keep it in my head. I know, kind of what's been effective with the most people the most of the time.
Yeah.
Yeah.
Have you done any research on your own or in the clinic?
Just with my master's and PhD work, I did stuff.
You did?
I haven't done any research on my own since then. I've just been in practice. I don't like the paperwork.
Yeah, yeah, and there's a lot of rules. Yeah, so that doesn't really interest you about clinical work, about researching at all?
No.
No.
I'm more of a hands-on help people.
So another thing I wanted to make sure that you got in, and that I wanted to just find out, is what kind of tools can you use, or do you use anytime or even often, assessments, psychological assessments, or programs that your clients use on the computer to give you an idea of what is happening in treatment, or the direction of where treatment should go? What kind of psychological assessments or psychiatric assessments do you implement?
I do some personality testing and some depression testing, stuff like that. Sometimes I don't do any of it on a computer. It's all paper and pencil tests.
What would give you what would motivate you to use that with the client?
Well,
that test?
to see just maybe what the depth of their depression is, or what areas it's causing. The Beck Depression Inventory breaks it out really well. Sometimes it helps that person see it in black and white, that is an issue.
Yeah, yeah, I could definitely see that. I've taken numerous psychological evaluations for work, and they don't tell you, which I think is really interesting, that the clinicians that you deal with, they won't tell you anything about what the assessments brought back. Yeah.
To me, that's unethical. If you take a test, you should know what the results are.
Yeah, that's true. I think that's the same thing. So I guess for the future, what do you think is going to be important in the practice? Do you see technology being a big part of counseling?
Sometimes a little bit of computer stuff with the testing and different things. In what I do, though, it's about two people working things out. It still comes down to people and heart-to-heart discussions. Learning new skills and learning new ways to live.
Yeah, and so you think a big part of what you do is that you actually do teach, psychological heuristics and tools.
People get better through relationship, not through computers.
Wow. So while we're right there, what pushed you towards therapy and counseling? As an individual. You said you went back to school as non-traditional student. What made that change, or what happened?
Oh, it just kind of evolved into that. It was something that I liked doing.
Yeah.
I've always been a people person.
They have taught us that in school, that a lot of people do go that route because they want to help themselves.
Yep, that's a lot of it.
And I think that's really scary.
Well, that's part of why in all the training you have to go through self-evaluation a lot.
All right. Yeah,
especially in your master's and upper grad students
right.
stuff. You got to do a lot of your own insight.
Yeah.
Else you could be dangerous.
Yeah, I think that same thing, and I really because when they told us that, like, it was just like maybe they said even half of the people that go into psychology do it just for themselves.
Well,
They had told us that, and I just was really confused about why that was all right, or because I do see when I mean, because I worked with psychiatric patients, and I did see that I loved I liked having a relationship with those people. It was a positive thing in my life, and that's kind of why I told myself I have to move on, because it was like if I do have a bad day, and then I don't want to be able to look at that like it's a good thing, like I'm having a bad day, but I go get it. Be with these clients. I don't think that's a good connection to have.
yeah, it can be unhealthy.
Right.
Mm-hmm.
Yeah, I do see that. So what do you think is, so you say, I mean, perhaps in 100 years, you do think that the person to person just trying to figure things out together is still going to be relevant.
That's not going to change.